Type 1 diabetics need to calculate and consider everything that goes into their mouth, right? Not just carbs, but proteins and fats and fibers. But if you've been sticking around on this channel for a while, you know that. However, what you might not have known is it's not just the calories that go into our mouth, but also the hygiene of our mouth. In fact, today, join me as I interview the author of this book, Saved by the Mouth, and the intricacies of oral hygiene, how it may impact blood glucose levels, insulin resistance, and more, and its connection to the gut microbiome and your system as a whole. This episode actually brought to you by our private community, the Warriors Tribe Plus. Had a chance to interview and receive the influence of Dr. Katie Lee as she shared this with my private clients. And we decided, you know what, this was a couple months back. We wanted to bring this out to the public because this interview was just so valuable. So I hope you enjoy this. This is a fantastic one. Stick around to the end. We'll get a little message for you at the ending of this one. And if you don't know who I am yet, my name is Matt Vandevecht. I get a chance to interview other experts in other fields for our private clients once a month. It's a ton of fun. But of course, we want to share this one with you guys. Now, I am a certified master fitness trainer and nutritionist. I live with type 1 diabetes, and so I steer a lot of our expert conversations into the realm of type 1 diabetes, as this one as well, with the mouth health and how mouth health can impact blood sugars. So I hope you enjoy this one, and we'll get into our interview just after our theme song. Enjoy. Well, welcome back, everyone. Today we've got a special guest on an important but often overlooked topic. We've got Dr. Katie Lee, who is a dentist, a speaker, an author. In fact, I've got her book pulled up on my computer. It's called Saved by the Mouth. I was checking it out. I might have to read that one myself. I was not always the best flosser growing up, so there's probably some gold nuggets in there for me. But she lives in Colorado. Dr. Lee graduated from the University of Illinois at Chicago in 2010, was an owner partner in over 80 dental practices throughout the U.S., served as a clinical partner overseeing 5 states. This is already impressive. We got a whole paragraph to go. She founded the Collective Health Society in 2024, which integrates several modalities of healthcare in one location to improve the health and wellness of patients. Currently, she is the Chief Clinical Advisor for Dental Innovation Alliance, which is an investment group that supports technology companies in the dental industry. Dr. Lee also consults with dental companies that aim to improve the clinical experience and clinical outcomes for patients. Dr. Lee is passionate about clinical education and mentorship, so she provides education on implant surgeries and oral systemic health. So you've got both sides, it looks like, both patient side and the dental side, and just trying to improve everyone's lives.
Yeah.
So Dr. Lee, thank you for coming on today.
Yeah, thanks for having me. I'm thrilled to be here. And, I know dentistry is not everyone's favorite topic. So I just always feel really humbled and honored when someone will allow me to speak with them. I know we're not everyone's favorite person.
Absolutely. I mean, I hate to say absolutely to that, but there is some truth to it.
Yeah.
I know that I've got a lot of ignorance around this topic, so I'm excited to dive into. I am one of the few, actually the only in my family, that was blessed with teeth that just kind of took care of themselves. All my siblings got braces and dental work and cavities, and somehow I snuck under the radar. And
it's amazing.
Haven't had a single cavity, and they're straight and everything. So I probably need to learn more about this to make sure I'm preventative in issues in the future. So within that, I mean, I know we'll talk about type 1 diabetes, that the impacts both ways that dental health can have there. But what are some, I suppose, key updates within the dental industry that maybe people just don't know about yet?
I think what people are really starting to understand, and kind of the work that I'm doing right now, is to really educate not only patients, but healthcare providers in general, that the mouth is actually connected to the rest of the body, which sounds really silly for me to say that. But, over 100 years ago, someone thought it was a good idea to take the mouth out from the body and make it its own kind of entity and profession. Because dentists used to be specialists of medicine back in the day. And then they took us out and we're kind of our own siloed portion of healthcare. But what we know now from the research, and the research has always really been there, started really gaining traction in the 90s, and then it's just been ever more prevalent since. But what happens in the mouth doesn't stay in the mouth, and the mouth can affect systemic disease. It can impair the ability to control systemic disease, or it can actually mirror what's happening in the rest of the body. So I'm working really hard to educate patients and providers that we need to understand what's happening in the mouth because it has a big impact on overall health and wellness.
That is so true. And, I think a great example to connect the two, dental health and type 1 diabetes, is the lesson that some of us are taught of sublingual absorption. So if you have glucose that you need to treat a low blood sugar, put it under your tongue, it can absorb faster. Different absorption rates with gums. And if the person's unconscious, don't put solids in there because they'll choke. But you can rub gel on the inside of the cheek because the cheek absorbs. So all these different pieces that I guess have been clues to us.
Yeah.
That
the mouth is a
connected.
gateway to the body, right? And I love that example you just gave. I haven't heard that one before. So I love that you just connected those dots for me. I haven't heard that used to connect it. I mean, so I love that you just brought that up. But yeah, the mouth is the gateway to the body, and what you put in the mouth affects how the rest of the body works, the chemical processes, the biological processes in the body. It's all connected. So thank you.
Absolutely. Well, and a joke that I'll share that the diabetics might get. So as type 1 diabetics, we take insulin for everything that goes in our mouth, right? I used to think that I was cheating the system by putting it in my mouth, chewing it, savoring it, the flavor of chocolate cake, and spit it out, right? Yeah. And then I learned later, as I'm going to get my certs for nutritionist, that digestion begins in the mouth. You got enzymes that are breaking food down. And I'm like, oh no.
Yeah. I mean, you did save yourself like a lot of damage, from the sugar and the flour and all the processed stuff. But yeah, it begins in the mouth. And a lot of people, gut health is in vogue right now. I think everyone is really talking about gut microbiome and gut health, which they should, because we have way more bacteria in our gut that's controlling our immune system and inflammatory responses than cells in our body. Mm-hmm. But what people don't understand is gut health begins in the mouth. So yes, health begins in the gut, but the gut begins in the mouth. You got to come back upstream, right? To figure out where does it start. So the mouth is where digestion begins, and you cannot have a healthy gut without a healthy mouth. Like they don't exist independently. And so oftentimes people will have gut issues and they do all the right things that they should for their gut, or mostly all the right things they should do for the gut, but they can't figure out why their symptoms won't resolve. And it's because they haven't really looked back upstream far enough to check on their oral health.
Interesting. So what does that look like specifically then? Is that doing a saltwater rinse? Is that supplements? Is it brushing 5 times a day? What are the tactics behind that?
So I think the biggest thing first is testing the microbiome. I'm a big proponent of testing, right? So it's same with diabetes. Like you guys are warriors, right? And knowing what your blood sugar levels are, you have to test and you have to know where you stand, because depending on where you're at, that's what you do next, right? Mm-hmm. And a lot of people are doing this with gut microbiome. They're doing a lot of testing, which is great, but no one's really testing the oral microbiome, or very few people are. And so before you can put a plan together and figure out what it is that you need to do, you need to know if there's something wrong, and then what is actually wrong. Because there's, I don't know, last I looked, it's like 754 different species that live in the mouth of bacteria. Wow. But then you have viruses, you have fungi, you have protozoa, you have all this other stuff that's going on. And if something is out of balance, you got to treat it, and all bacteria are not treated the same. Most of them are resistant to cleaning alone. So then at that point, you have to throw in some adjunctive tools and procedures to try and get you back in balance. But once you're in balance, it's pretty simple to stay there, I will say.
Oh, okay. So what does testing look like then? Is that something you just go in and get labs drawn, or?
It's just a saliva test. And so that's one thing I can tout, because, we're known for like torturing people, right? Like you come to us, we cause a lot of pain. We're poking, we're prodding, we're sticking needles in you, we're drilling onto you. This is one thing you just literally swish and spit, and we can analyze saliva. It's the new blood for us. And we can analyze your microbiome and figure out what's going wrong and what needs fixed.
Well, that's very encouraging. And I'm assuming it's not like the early days of COVID testing where they stick it like a foot down your throat.
Oh, right? That was like horrible. Right? I remember, this is a side tangent, but I remember, where was I? Switzerland, maybe Austria. I was at a conference and I was trying to come back to the US, and you have to get COVID tests before coming back. Oh, yeah. And I remember the lady looking at me saying, I need to get into your pharynx with this test, like your throat. And I was like, but in the US, we go through the nose. And she's like, I'm going to go through your nose. And I was like, oh no, this is no. Yeah. So she did it. Anyway. I digress, but I have PTSD from that. I think that memory just popped up.
I can appreciate that. Yeah, I was
Yeah.
like, I'm gonna do this. It's not gonna be a problem. And then I was just, my eyes welled up
Horrible.
immediately. Yeah.
Yeah. But I mean, it's same concept, right? Like we're trying to swab and hatch. In that case, it was a virus, but we're trying to, test for what we can't see. You can't fix what you
Right.
can't see.
Absolutely. Well, and speaking of, when you can't see it physically or just are ignorant of it, one thing that comes to mind I've seen in a number of dental forums is periodontal disease. Can you
Mhm.
talk a little bit about that?
Yeah, that's the big one that we're constantly fighting. When we talk about the most common diseases in the world, about 70% of people of the population in the world have some form of gingival disease, yet it's never listed once on any country's top 10 list, which is crazy.
Wow.
Because you think that it should be, right? If so many people have it and it's so common, but it's not listed as the top incidence of disease. So that's really important. But the reason why periodontal disease is so concerning is because in the past we haven't quite known what was causing it. We just knew that all these people had issues with their gums and losing bone around their teeth.
Hmm.
And we didn't quite appreciate that once your gums become leaky, just like you have leaky gut, same concept, leaky gums,
Oh.
that's what's allowing the bacteria from the mouth to get into the bloodstream of the rest of the body.
Oh.
So, sure, we don't want to lose the bone around our teeth because our teeth will fall out. But gum disease is actually the connection between the mouth and the rest of the body because
Hmm.
during the day, you're swallowing at least a liter of saliva, which is really gross if you think about it.
Wow.
And you're swallowing over 1 billion bacteria a day. But most of those bacteria are eradicated in the stomach and the small intestine because it's so acidic. And so we really don't worry about bacteria getting into our system that way. Where we do get concerned is when it gets into the bloodstream. So it's bypassing that protective mechanism of the acidic stomach.
Hmm.
And instead, it's going through the gums and getting directly into the bloodstream. And then the bacteria from the mouth are circulating and taking up residence in other parts of the body where they shouldn't be. And then that's when you end up with things like cancer, fertility issues, heart disease, type 2 diabetes, and dementia and Alzheimer's.
Well, and a lot of the reports that I saw showed a correlation between periodontal disease and a higher A1C value, which you mentioned can lead to type 2 diabetes. I wonder if there is an impact on just glycemic control in general for
It does.
everyone.
Yeah. And so a couple different things come into play. So there's some, talking about type 2 here, there's some oral bacteria that will directly attack the beta islet cells of the pancreas and destroy them.
Oh, wow.
So that impedes insulin secretion, obviously, and can lead to poor glycemic control. The other thing is that, inflammation really is the root cause of 95 out of 100 diseases that we face. It's not genetic component. It's not really, bacteria, although bacteria start it. But once you have a systemic inflammatory response, it's really up to that host's immune response. So the patient's immune response, whether or not disease is going to set in. And when we have something like type 1 diabetes, we get really concerned about glycemic control, what you're saying, and how the mouth affects that is inflammation. So if you have a microbiome in the mouth that's out of balance, so we call that a dysbiosis, that's going to cause the gum tissue in the mouth to break down. Now the bacteria from the mouth go through the gum tissue into the bloodstream, and now that bacteria is going to cause inflammation inside the blood vessels. So that's how you get kind of the systemic inflammatory vascular response. And we know essentially diabetes is a systemic vascular inflammatory condition, right? Heart disease is going to be inflammation in the heart. Dementia and Alzheimer's, is inflammation in the brain. A lot of countries call it diabetes type 3 because it's more vascular inflammation of the brain. And so oral bacteria absolutely affect glycemic control because of the amount of chronic systemic vascular inflammation that it causes. And so we know that patients that if they're diabetic and they undergo perio treatment, so gum treatment, they will reduce their HbA1c by 0.4%. So if you're at a 6.5 and you have gum issues,
Right.
which by the way, 87% of diabetics have gum issues, 87%. By getting that treatment, you can reduce your A1C by 0.4%, which is pretty cool.
Goodness. So,
Yeah.
a couple of questions that brings up. One is, I know we've seen a lot of responsive treatments on inflammation, right? The types of food, supplements, exercise, lifestyle habits. But what can we do proactively to reduce
Yeah.
inflammation? And is it as simple as just brush your teeth more?
There's so much. So first thing I would say is get the saliva test, because you got to figure out if there is a problem. If there's a problem, we can treat it. And that test tells us what bacteria is present and how to best treat that bacteria. It also will let us know if your good bacteria in your mouth are strong enough, or I say robust enough, or plentiful enough. So it's about reducing the bad, but also supporting the good, because we want your own microbiome to be its own kind of army, right? And prevent any issues in the future. Once we get that balanced, then a lot of things, I talk a lot about nutrition and supplementation. So you can eat and supplement for oral health, which is really important.
Okay.
But then just basic cleaning stuff that I think we've been told our whole lives, but we've never really valued, is critically important, such as you have to brush for a minimum of 2 minutes, at least twice a day. It really should be 3 times a day. We also must floss with the long string floss, not the floss picks. Have to do that every time you brush your teeth, because your teeth have 5 surfaces. You have the top where you chew, the tongue and the cheek side, but then you have in between the teeth. And in between the teeth is where the gum tissue is. You have the pointy gum tissue called the papilla. That papilla is where the bacteria from the mouth are getting into the rest of the body. It's through that papilla. So if you don't floss, you are not cleaning the most crucial surface of your teeth that's keeping the bacteria in your mouth from getting into the rest of the body. So flossing, no one likes it, but it's critically important. You can't replace flossing, but you could supplement it with water picking, because some people just have a hard time, getting in between spaces with floss. So you could water pick.
Before or after brushing?
This is the age-old debate. I was trained that you're supposed to floss first, kind of like you sweep the corners before the main floor. But here's the real kicker. Less than 5% of the population actually flosses their teeth. So when people tell me, do I floss first or after? I say, I don't care. Just floss. Just do it. And there'll be people online that are like, oh, should I mouth rinse before or after? And I'm like, again, it doesn't matter. Just get them all done. And then the other big thing is tongue scraping. That's a really big one that people need to do, because your tongue has its own microbiome. And it's filthy dirty, to be honest. And you got to clean that, because that is a surface that houses bacteria. And in diabetics, it's extremely important, because a lot of fungus can grow there. And in diabetics, oftentimes we'll see a lot of fungal infections in the mouth, especially if they have a hard time controlling their blood sugar. So that's critically important to clean that. But even, I would say, something that we didn't understand for a really long time was the types of products to use. And so everyone was using the main big toothpaste and toothbrush conglomerates, Crest, Oral-B, Colgate, all of those. And what we know is they're filled with really toxic, poisonous chemicals, which is why there's a poison label on your toothpaste that says, if you swallow, contact poison control.
Oh my goodness.
But as you just mentioned, we put glucose under our tongue to immediately boost our systemic blood sugar, right?
Right.
What do you think's happening with those chemicals in the toothpaste? Sure, you're not swallowing them, but you're absorbing them for sure. So I always say, use a more natural, holistic toothpaste that's chemical free. Use mouthwash that doesn't contain alcohol, that's chemical free, yada, yada. So more gentle oral healthcare products, I would say.
Years ago, my wife picked up on that with the toothpaste. And
good.
At first, I was just like, you kind of sound crazy, because everybody else is using Crest and Colgate. Yeah. Years later, I'm like, thank you.
Yeah, she was right. Well, and I did too. I mean, I'm a Western trained dentist, right? So all of those companies, and they mean well. It's not like they're trying to poison us. They would come to our school and tell us about how, I remember, one of them came to our school right when they started putting triclosan in their product. And they were like, we're the only company that puts triclosan in our product. It's antibacterial, it's proven to do all these great things. Well, now triclosan is illegal because it causes cancer. So it's actually been forced out of all hand soap products. You can't even use it in hospitals anymore or put it in hand soap. But yet, to my knowledge, I should double check this, but when I wrote the book, it was still in the toothpaste.
Oh my goodness.
Yet it's labeled like as a type 1 or something carcinogen, and it's not allowed in hand soaps anymore. But we put it in our mouth.
Terrible.
Which our mouth is way more absorbable, absorbs way more things than our skin, right? That's why we put glucose under our tongue instead of just hold it in our hand.
Mm-hmm.
You gotta be careful what you
Could
put
you
in.
imagine? I'm just holding it in my hand.
Yeah, just like
it's my skin. It's going to absorb.
Yeah.
I'm kind of curious though. If I just left my hand in a jar of honey, if anything would happen, I kind of want to.
I don't know. You'll have to check that out and see.
Yeah. So at the step 1, the labs. Where do I go for that swab?
So I would say every dentist, you do not have to have a special license as a dentist to be able to do saliva testing. Okay. So I will start by saying that. However, probably less than 5% of dentists know about this stuff and actually do it. So the way you're probably going to be able to find a dentist that will do a saliva test is look for a biological dentist or a functional dentist. If you look up on Google one of those, they'll be able to do it. If not, there's telehealth providers such as myself where we can do consults with patients, ship them test kits. They can take the test at home, and then we'll go over the results and create a care plan for them once we know what's there.
Very cool.
Yeah.
Okay. So something that came to mind, we're talking about, absorption in the mouth and all this, and the gums are the gateway for the rest of the body. My cousin is also a dentist. He owns his own practice, and we were discussing diabetic health and all this. And he says, most of the diabetics that I see have issues with sugar consumption, not because they eat too much sugar, but because they're treating low blood sugars. Right? Like they have to eat it. They have no choice, but it's wreaking havoc on their gums because they consume it in the middle of the night and go back to bed. So one of his thoughts on how to navigate that was, at the very least, you should swish your mouth aggressively with water before going back to sleep. Brushing would be best, of course, but he suggested to do the aggressive swish and or brush even after consumption of fruit or acidic foods. What are your thoughts on that?
So I love what he was saying. So a big part of, it's clear that oral microbiome dysbiosis does not cause type 1 diabetes. We know that. We also know that a healthy mouth will help control blood sugar in type 1 diabetics. And we also know that type 1 diabetics will have a ton of tooth issues. So yes. The other thing is that wreaks havoc in the mouth is actually frequency of eating. So he kind of hit on this. And you just kind of mentioned this, right? It's like, and I never knew this, but for a long time, we were always taught it's better to eat more frequent small meals than to eat twice a day, but huge meals. And so that's how I grew up in the 90s. But what we know now is like, that's terrible for oral health because every time you eat, since digestion starts in the mouth, which you mentioned that we have salivary amylase that's excreted to help break down carbohydrates. Every time you eat something, the acid and sugar in the food is going to drop the pH in the mouth. We also drop the pH in the mouth to start breaking down our food. So when that happens, if you have cavity causing bacteria in your mouth, it's now feeding on the foods that you're eating and taking advantage of that acidic pH environment to cause cavities in all your teeth. So a lot of times we'll see diabetics with tons of cavities because they're eating so frequently, or because they have to do glucose to try and bump it up really quick. Or if they have high blood sugar and they're unable to control it, their saliva will actually be kind of sweet tasting, or they'll actually have high sugar content in their saliva, and that bathes the teeth and causes a lot of decay around the gum line. So your cousin is absolutely correct. It's better to swish vigorously with water afterwards. I would actually recommend waiting 30 minutes to brush your teeth after you eat, just because that's the time frame that your pH is dipped. So after you're done eating, your pH is still low for 30 minutes. So you don't want to go brush right then because you're brushing everything into the teeth and kind of brushing away that soft enamel. So better to rinse. There's a lot of I'm testing these things out right now. There's a lot of really good oral probiotics on the market. This is upside down tooth guard. There's a lot of really good probiotics out there that will kill the bacteria that cause cavities. So you could pop one of those in when you're done eating, or like a mint that, like an oral mint that contains xylitol. Xylitol will kill the cavity causing bacteria as well, and kind of give you a buffer for that 30 minutes until you can brush your teeth.
Interesting. And as we were talking about this, I mean, just to further the discussion on everything being connected, as a type 1 diabetic, we have to titrate our own insulin dosages, right? So if your insulin is off, blood sugars aren't controlled, it's much more difficult. But if you're taking too much insulin, you have to snack continuously to make sure you don't go hypoglycemic. We call it feeding the insulin, right? It's too much. And I can see how this would just be this cyclone of disaster. You know, I have to eat more, dental health gets worse, I have to take care of that, but now blood sugars aren't controlled, and that's tricky. And
so the biggest thing is like eat something, you know, and you would know what's best to eat in these situations, but like I wouldn't go for like a Kit Kat, right? Which is what I just had before getting on this call. You know, I always say try and stay away from anything white. So white flour, any, you know, processed foods like pretzels or crackers, those are actually worse than just eating a sugar cube, to be honest, because it sticks on the teeth. If you've ever, you know, when you get done eating crackers, you have food stuck in between your teeth. That high processed carbohydrate gets stuck on the teeth and the bacteria just eat it alive. They love it. So, you know, if you're eating healthy stuff or complex carbohydrates that take longer to break down, that's going to be much better for oral health. Rinse with water. I always say try not to have sugar or eat frequently and do acid. So if you're going to be eating a lot, eat with water.
I imagine the drug, like, don't do acid. I'm like, obviously.
Like, don't have like a candy bar and a Diet Coke, right? Or like, don't have, you know, an apple and coffee. Like, try and keep sugar and acid separate if you can. That's going to be the best thing. And then when you're done, swish with water, pop a mint that can kind of buffer you until you can get in and brush.
Well, I love this idea of almost generalities within advice. So you're like, just stay away from the white stuff, right? What other generalities or simplifications do you have that might make it easy to remember a lot of these healthy habits?
Yeah, that's a great question. I don't know. I should probably write those down. A lot of this, I just talk off the cuff. Yeah, I mean, biggest thing is I say when you're eating, eat with water. That's a big one. Stay away from the white stuff. If you're going to be snacking, don't combine sugar and acid. That's a big one. And then just the 30-minute time window. I think all those are super important. And added sugar, I feel like that's, you know, I get questions of like, oh, I'm eating something that has a lot of sugar in it, but no added sugar. So I tell people, like, if you can, stay away from added sugar. If you can just focus on that, I'm okay. Because if they eat fruit or something, right, that's going to say it has a ton of sugar in it, but it's not necessarily going to be nearly as terrible for your teeth as eating a candy bar or a bowl of cereal.
Right. Well, and an exercise that I love to do with a lot of our experts, or even just for myself, is imagining how to wreck your life on this topic as a way of reversing the advice. And then, of course, by extrapolation, we can figure out what you're supposed to do. So if somebody wanted to wreck their dental health and make diabetes as hard as possible, what would they do?
Eating sugar, snacking all day long on sugar and processed foods, and sipping on acidic drinks, Diet Coke, coffee, carbonated water, juice, full sugar sodas. That would wreck it.
So diet as well.
Diet because of the acidity. And I love Diet Coke. So like, I know that that's horrible. I can see you judging me right now, but you have to live your life sometimes, you know? But if I'm going to have it, I have a mini can, I put a straw in it, I drink it all at one time, and then I swish my mouth out with water. And then 30 minutes later I brush. So like, there's these little hacks that you can do to get around a lot of this stuff.
You know, you mentioned straw, and that just lit a question in my mind. I've heard the same thing. Well, straws are good for a number of reasons. One, you end up drinking more, trying to get water in. But does that help bypass the teeth enough where it can be a strategy?
It does. It does. And the other big thing is the time it takes you to drink it. So like back before I knew all this stuff, I would have a Diet Coke throughout the day, right? Like I would just take little sips here and there. That's like the worst thing you can do, because again, every time you put something in your mouth, you're dipping the pH, and now I'm throwing an acidic drink on top of it. So it's like a double whammy. So I always tell people, and I just did a post about this, like, tonight's Halloween, you're going to get candy. I would encourage you to sit down, and if you're going to binge, like, go for it, get it out of your system. Do it at one time. Don't walk around and have little pieces of candy throughout the day. That's way worse than you sitting down and having a binge.
Very interesting. Well, now I'm
because
scared
of
to
the,
ask my next question.
no, go for it.
I've read recently, so this is actually electrolytes with water. I've
Yeah.
read recently that this one, it's a salty electrolyte mix called Element. Uh,
Oh, I
that
was just looking at that one actually. I was thinking of
ah
buying. Yeah.
okay,
Do you like it?
I love it. I'm addicted
Okay.
to it, but I also
Okay.
love
Good
salty
to know.
things. So
So do I.
I've
I put Himalayan salt in my water in the morning to
oh yeah,
hydrate. And so I was looking for, because I love carbonated water, which again is not great for your teeth. So I was looking for something else that I could do.
yeah, great company, really good stuff.
Okay.
But I've
Okay.
read recently on forums that those like me who have 40 ounces and sip on it throughout the day are messing with the pH levels in your mouth, and that salt, when spread out across the day, is increasing the risk of cavities. Is there truth behind that?
That salt is?
Yeah.
I would think salt is alkalizing, makes it more alkaline. I would think that's a benefit. Plus,
Oh,
salt has really good minerals that are great for making your teeth nice and strong.
that's what I was
Um,
hoping. Yeah.
yeah, I would say if you're sipping on that throughout the day and it has sugar in it, or if it has like an artificial sweetener like an aspartame, that's going to cause systemic inflammation.
That sounds good.
Um,
Yeah.
but no, I wouldn't. I personally wouldn't be worried about that. I would say could it happen? Yes, but it's going to be a lot more. It's going to be much more minimal than sipping on like a LaCroix or Spindrift all day long.
Oh, sure.
You
Okay.
know, I think you
Gotcha.
got it. Like I said, you got to live your life. You can't, got to
Yeah.
have a little.
We can't all be, is that Brian Johnson, the life
Yeah.
biohack guy?
Yes, you got to
But, and
yeah.
actually, he's a big fan of supplements. I just read he has like 100 and something supplements every day, pills. But
Wow.
I assume that there are some supplements that can be beneficial for dental health. I've read in the past, like D3 plus K2. I think vitamin A was on the list. Do you recommend supplements specific for dental health?
Yep. So, yeah, and I talk about this in my book too. I have a whole section for solutions of like things that
Hmm.
you can do to mitigate some of our lifestyle choices,
Yeah.
and then things that you can add to your routine to kind of boost your oral health or prevent damage. A big one is D3K2.
Okay.
So D3 is anti-inflammatory, which we love. It
Mhm.
also is great at helping prevent cancer. But the big thing about D3 and oral health is, again, it reduces inflammation. So it's great for gums. But when you combine it with K2, K2 tells D3 to bring calcium into your bones and teeth. A lot of
Mm.
people make the mistake of just taking calcium and vitamin D together. That will the vitamin D will deposit the calcium into your arteries and kidneys. It goes into soft tissue because it wants to take the path of least resistance.
Mhm.
So that's why a lot of people, and there was a big study on this on postmenopausal women taking calcium and vitamin D after menopause, and what they found was it actually increased their risk of heart disease, of hardened arteries,
Wow.
because the vitamin D was putting all this calcium in the blood vessels.
Mm.
So you got to have it with K2 if you want it to go into your bones and teeth. But then you also need magnesium to activate vitamin D. So magnesium is another one I'm always telling people about. Magnesium is also great for digestion. It helps you go to the bathroom, but it
Mhm.
also is great at relaxing you at the end of the night.
Yeah.
It's really great if someone's clenching and grinding because they're really stressed. I always tell them to take magnesium before they go to bed. And magnesium, I would say all of us are depleted in magnesium. It's the first mineral really that gets depleted during stress. So you can
Mm.
never have too much magnesium, in my opinion. Vitamin A is great to help build teeth as well. And then another one that's great, especially for people that have gum issues or diabetics, for example, need to be taking a high dose of liposomal vitamin C
Hmm.
because vitamin C is crucial for collagen repair and wound healing. And collagen is what makes up our gum tissues. So if we want to make our gum tissues as strong as possible. That way, the bacteria in the mouth don't cause them to break down, and then the bacteria in the mouth can get to the body. So vitamin D is critical. Vitamin C is critical.
Love that. Yeah, it's fun to have, at the very least, a checklist of a protocol, so you
Yeah,
know what am I missing, what should I check into, even if it is
totally.
just asking your doctor to run a quick blood lab and see where you're
Yeah,
deficient, right?
totally.
But yeah, going above and beyond and making sure your body has the proper combinations, like you said, K2 with
Yeah,
D3, is critical.
yeah. A lot of people
So
don't know about K2, so I'm
I
glad you brought that up.
know I just found that out like 3 months
Yeah,
ago. and started
Yeah.
changing my D3 as well. And now
Yeah.
they sell it at Costco. You get the combo where it's both missing
Yeah.
still. I love
So
it.
I saw it at Costco a couple months ago, and I like did a whole
Ah,
Instagram post about this because I was so excited because
yeah,
all my patients are like, "Where do I get D3K2?" And I have to send them to like some obscure website,
right,
not obscure, but like not one that pops up at the top of Google to
right.
get vitamin D3K2 because you can't find it a lot of places. So when I saw Costco had it, I was like over the moon.
Oh yeah, it's so simple to get your stuff from
Yeah.
Costco. I love it. So you
Yeah.
mentioned a lot of these pieces we talked about are from chapters in your book, supplements being a big one. Can you tell us a little bit about your book and what somebody might get out of it if they were to read it with type 1 diabetes in mind?
Yep. So I wrote the book. I had exited all my offices at the end of 2022, and um, what I was finding when I was practicing was I had all this knowledge, and I was constantly telling, like I was on a recorded tape all day long, just telling people about the like oral health and how it's affecting whatever systemic condition they had, because what is it, like 6 out of 10 Americans have a systemic disease,
Hmm.
something crazy like that. And so I was always trying to tell them, like, hey, if we take care of your oral health, we're going to be able to help improve your systemic issue, whatever it is. And so when I left, I didn't want that knowledge to like, kind of die down. And so I just thought, let me put it in a book. Let me make it as entertaining as possible. So that way I can lower the friction when it comes to having conversations about oral health. So the book is Saved by the Mouth. It's really cheeky written. It reads just like a conversation. My brother, who like is anti health, what, I don't know if I should say that, but like he's not into me being a dentist whatsoever.
Yeah.
He read it and loved it and texted me and said, I felt like I was having a conversation with you. Like that's
Hmm.
how cavalier it's written. And so every chapter of the book, I talk about how oral health affects a specific systemic disease. And I tell a true story of a patient in my practice that had that condition and what they came in with, what we did to fix their oral health, and how it helped them systemically. So I think it's a pretty fun read. And then at the end, the whole last chapter is about nutrition, lifestyle, oral health hacks, things that you can do to try and fix things on your own or keep yourself healthy.
Hey, I might have to get one of those copies. That sounds like a
Yeah,
good
I'll
read.
send you one.
Oh, I
Yeah.
love that. Well, and you mentioned the stories too. Can you share maybe a summary of either your favorite story or maybe the most shocking, something that comes to mind?
Yeah. Oh my, there's so many. Um, so one that probably impacted me the most was I had this new employee come into my practice. She was at one of my satellite clinics here in Denver, but not my main office. And so when I saw her there, I went up and saw that she was new. So I introduced myself to her and she said, "Oh, I know who you are. You saved my life." And I was like, okay, well, now I feel really bad because I don't remember you. Like, tell me where this came from. And she said, I was actually your patient. And then when she started telling me her story, I was like, oh, like I even remember what her gums and teeth looked like, right? Dentists are weird that we remember people's mouths, but not their names or faces.
I
Um,
appreciate that.
yeah. So she starts telling me her story. And what happened was she came in, young girl, healthy, nothing on her medical history. And we started doing her oral exam, and her gums were bleeding more than I've ever seen anyone bleed before. I mean,
Oh
just
no.
like you would look at them and they would start bleeding.
No.
However, she didn't have very much plaque or tartar on her teeth.
Hmm.
You would expect someone to bleed like that if they have really dirty teeth, right? Like if
Right.
they're not taking care of it, it's going to cause bacterial infection, inflammation, all of this. So I was like, this is really unusual. So I said, let's do some tests and see if you have a microbiome issue or an inflammatory issue, and we'll go from there. So we did the test, and she did have a couple bacterial species that were off the charts, specifically FN and PG, which are implicated in fertility issues and endometriosis. We know that now. A third of all endometriosis cases are caused by FN bacteria from the mouth.
Hmm.
And we did an enzyme test also, and her enzyme test was through the roof, meaning that she was losing collagen throughout her entire body at a rapid rate.
Wow.
And so when we did the treatment, and she came back 3 months later for us to recheck and do a new cleaning on her, and she was better, but still not where I would expect her to be. And so I said, I think you need to go see your doctor and get some more blood tests done. And so she did. And turns out she had systemic endometriosis. She even had lesions in her lungs.
Oh, jeez.
And she had been seeing her primary care doctor. And this isn't a primary care, like no one missed it. It's just outwardly, she looked totally healthy. No symptom. I mean, she had all the regular female monthly cycle symptoms, but like no one would have ever thought that that was an issue. And once she got diagnosed, she got treated, she got into remission. And then keeping her healthy orally was a big component of keeping her systemic endometriosis in remission. And now studies actually came out, and it was 2022 or 2023, about FN directly causing endometriosis. And that was the bacteria that was high on her report with me, which when I wrote the book, that study wasn't out yet. So just cool. So I'd say that was probably the most impactful one.
Yeah, what a great opportunity to be the one that noticed this little subtle nuance that nobody else is picking up on, and it have such a lasting impact on that patient.
Yeah. I had another one. She was type 2 diabetic. Love this woman. She was a Greek woman, older. Her A1C was always 12, 13, just like could not get it under control. And she was suffering dentally. She had cavities on all of her teeth, very bad dry mouth. And when you have really bad dry mouth, it makes your cavities worse. It makes your gum inflammation worse. And it actually makes your gums feel like sandpaper. It can be really painful.
Oh, no.
And you can also suffer from something called burning tongue or burning mouth syndrome, where it literally feels like your mouth is on fire at all times. And so she was suffering so much, and nothing that her endocrinologist did could get her A1C down. And she would come in, and we were just doing what's called palliative emergency care. Like we would just kind of extract teeth as needed or patch them, just because like her teeth were just disintegrating before our eyes.
Oh, man.
And it's not recommended to do surgery on diabetics with A1Cs that high, because they could not heal, and they could die from that. They could get sepsis and die. And we got to a point where she came in and she was just in absolute despair. And she just said, I just want to die. And her daughter's looking at me like, please do something. And I said, well, we can try something, but like, I could lose my license for this. Like, this could be really bad. But if I work with your endocrinologist, if I work with a gum specialist called a periodontist, there's some new procedures and products on the market that we could do. And we could try and take all your teeth out and replace them all with dental implants and see if we can get you healthy that way. And so, of course, I had her sign everything under the sun. She fully knew, she knew that this was like a big gamble, but she was hopeless at that point. And so we had about 4 months of workup, pre-care workup, where we were trying to put everything in order, making sure she was on the right medications, balancing hormones, balancing her microbiome in her mouth. I mean, I don't want to make it sound like it was overnight. It was a big process. But once we knew her microbiome was stable, her inflammatory levels were down, she was on the right drugs, we extracted all of her teeth, replaced them with implants and a whole new set of teeth. And her A1C dropped to 8 within 21 days.
Wow.
And her endocrinologist called me and said, what did you do? And I was like, I took out her teeth. And so that just goes to show the direct correlation, right, between oral health and systemic health. So, and a big piece of it was she was out of pain. And so she was able to eat the foods that she needed to eat to be healthy.
Yeah.
When you can't chew and when you're uncomfortable, you're going to go for soft processed, high sugar foods, which is what she was doing. But now she was comfortable. She could eat what she needed to.
Wow. Way to go. That is just so exciting to hear about that. And the people like yourself who are dedicated to digging deeper, right? Where instead of just dismissing it and going, I don't know, that's just how it is. You dig in and research and work with it. It's fantastic.
Yeah. So we're building that at the new health center. So Collective Health Society, we open in April. So we're putting all types of health providers in one roof. So dentists, functional medicine doctors, naturopaths, endocrine, everybody is in one roof.
My wife's not opposed to moving to Colorado. I might have to bring it up.
Even when I was practicing, I had people flying in from Alaska.
Really?
Yeah. And it's a nice, we call it medical tourism, right? A lot of people fly to Mexico for care or Thailand for care.
I've seen that.
Yeah. You can fly in Colorado now.
Wow. Okay. Well, that's very cool. And certainly simplifies the chaos of navigating 10 different specialists, right?
Totally. Totally. Go to one center, get everything done, and then you're done.
Removing a lot of the hurdles. That's really cool. So April, you said, is when it's going to be ready?
April 1st, hopefully.
April 1st. Okay.
I keep saying that and putting it into the universe. So hopefully my contractor hears it. And I keep telling him, like, I'm telling everyone it's April 1st. So you have to have the building done by then.
There you go. I mean, I do the same thing with deadlines where I'm like, this thing is happening on this date. And they're like, it is? I'm like, I don't know, but I said it. So now I have to do it, you know?
Totally. It's out there. Yeah. You have to finish the project. So
yeah. Well, very cool. I wanted to respect your time. Obviously, you've been here chatting about a lot of deep topics within this, but before we wrap up, where can people find your book, more info about your center, about you? What are the best places to go?
So two best places to find me. One is on Instagram. So Katie Lee D.D.S. I get tons of messages, oral health questions on there. So people can feel free to reach out to me there. The other place is my website. So katieleedds.com. They can purchase my book there. I also have the chapter that they can download for free if they want to read the first chapter. And then they can also purchase a saliva test if they need one. And then they'll get a consultation with me so we can figure out how to get their mouth healthy.
I'm going straight to the saliva test. For anybody I'm super curious now.
There's been three podcasts now where they've gotten the test ahead of time, and then we do the podcast and we go over results live.
Oh, and everyone's like, a good idea.
Everyone's like, oh shit, like what do I need to do? So yeah, it's pretty eye-opening.
That's exciting though, because I mean, if you're blind to it, it's just going to get you later. So you might as well get shocked now with the results, right?
Yeah, fix it now. The best time to get treatment is now.
Love that. Well, Dr. Katie Lee, thank you for all that you're doing in the dental community and bringing together all these holistic experts under one roof. It's just an amazing project, it sounds like, and I actually do look forward to following up on that. So thank you for coming and sharing your expertise. Anything that you want to add that we didn't cover? Any golden nuggets that our audience should know about?
Yes. And thank you for bringing that up. Another one I would say that I would encourage everyone to do is to get their airway checked. Airway health is the probably biggest health crisis we have right now in the US, because so many people have airway issues and don't know about it. So 85% of diabetics have an airway issue.
Oh.
And if you have an airway issue, it's going to cause dysbiosis in the mouth. So it affects your oral health, but it also increases systemic inflammation, which is really important for glycemic control. So any patient of my practice that is a diabetic, I always have them get a sleep apnea test or a home sleep test, just to rule out any airway issues. So airway is critical.
So airway, is that specific to sleep apnea, or does that extend beyond that?
I mean, there's other things with it, but what I'm talking about is sleep apnea.
Okay.
Yeah.
I'm glad I asked the golden nugget question then.
Yeah. A lot of people say like, oh, I don't have sleep apnea, I don't snore, and I'm in shape and I'm thin. Like that does not matter.
Wow.
So I always say get an airway test.
Huh. And where can you find an airway test?
I just did this. I'll give you a link. Maybe you can post it with the show. Because I just did this for another patient. I will have an airway clinic in my new practice. We're going to have a clinic solely devoted to airway. However, right now you can actually get, it's a company. I'm not familiar, or I'm not affiliated with them whatsoever. I just found them online. So I'll give you a link. You can order the test through them, and they will actually give you the reading and the diagnosis. And I think it's like $150. It's pretty cheap.
Oh, wow.
So I'll send you the link and you can add it. I should contact that company because I've been talking about them a lot lately.
Yeah, get an affiliate link or something.
I should. Yeah.
No, I'll check that out though. We'll certainly put that in the show notes for everybody to check out as well, alongside your links and recommendations. But again, this is amazing stuff. I'm pumped whoever thought I'd be excited about.
I know. See, I've done my job. Like every time they have a dentist on, I'm like, I promise this isn't going to be terrible. Like, we'll make it fun.
Love that. Well, thank you for sharing your valuable time with us. We'll let you get back to changing the world, and make sure everybody else has the links to check you out and grab your book. So thank you so much, Dr. Katie Lee. You're awesome. Everybody else, thanks for hanging out, and keep up the fight. What a fantastic interview. Now, of course, in our private community of the Warriors Tribe Plus, that's where a lot of my clients hang out, talk, ask questions. Of course, they had the opportunity to continue this discussion when this was live into a Q&A to discuss potential impacts of their own oral hygiene and to set up action plans. Now, if you don't know about that community, if you're not part of it yet, that's okay. Stick around. I'm sure we'll open up the doors again at some point, though it is closed to new clients right now. But in the meantime, I do have 2 recommendations for you. All right, and the first one is this book, Saved by the Mouth. This is the book that Dr. Katie Lee actually sent me, and I will be going through it right now. So if you'd like to go along through that book and gather all of her golden nuggets, that's a great one. Second book, of course, is the Blood Sugar Freedom Formula, written by me. In this book, we talk about how to set up your blood sugars for success so that together you get a whole system, right? And we're not in partnership, but these books so far do seem to go pretty hand in hand. So I'd recommend grabbing both of them. They will help you on your blood sugar journey, but also on your overall health journey. So the Blood Sugar Freedom Formula, as well as Saved by the Mouth, you can find on Amazon. So I hope you enjoy those. Hope you enjoyed today's episode. And if you have not yet, consider subscribing if you want to see more of this kind of content. We'll see you next time, and keep up the fight.